It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing.
Hey everybody, welcome to Ageless Health live stream with yours truly, Dr. Tom, and we've got a good show for you today, one that is kind of stacking on what we've already started with. Pain has to do with sugar, and what does that really have to mean with your arthritis, your degeneration, your gout? Well, we're going to talk about that in a second. It's a kind of a spinoff of what we were just touching upon on WMAL 105.9 a few moments ago. But the truth of it is that pain is one of these things that should never be blunted. It needs to be understood. And if you understand it and you know where it's coming from, then you can take an action step to resolve it, to correct it, to make a difference. So, but what we're going to do is we're going to talk about it, how it affects joints, how it gets in, and whether it's a joint of your spine, whether it's a joint in your hands, whether it's your feet, your neck, your shoulders. Why is the pain there to begin with? Now, there could be a lot of different reasons, but why does it perpetuate itself, or why does it suddenly show up? You know, last week we talked a little bit about something called glycation, and we'll touch upon that just gently today, but that's just a piece of what we're going to talk about. Glycation simply means that, you know, you have that caramelized substance that happens when sugar is heated. It gets into the joints, it gets into arteries, it gets into the brain, it gets into all kinds of areas, but it can cause a problem that extends into something called perpetual ongoing pain. And we're going to talk about all that in just a minute. But I want you to take a look at something before we get going. This is a model of your spinal bones, right? So when you're looking at it, you're looking at two bones individually. The bones are called vertebrae. And in the middle, there's this disc. This is a shock absorber. And it allows you to bend and twist and turn and come back to normal. This is the back. This is the bumps that you'd feel if you ran your fingers down your back. Now, as long as these two vertebrae, these two bones are in alignment, you have a nice big hole that allows this nerve to come out, and it fires properly and it signals properly to the muscles, to the organs, and so forth. Now, but many things can happen to it, from trauma, knocking it out of position just a little bit. My world, we call that a spinal subluxation. Osteopaths call that a spinal lesion, by the way. The situation is the same. It causes an overstretch reaction or a compression reaction on the nerve root, and it alters the signaling. But that alteration could be just several things, but one of them is pain. So we're going to show you how that progresses if it's not resolved, ultimately ending up with something that looks like this, where you have a tremendous amount of degeneration. You've got that old thing called spinal stenosis, which is a narrowing and a crushing of that nerve root. So obviously you're going to have neuropathies, and you're going to have all kinds of extension pains and the like. So we want you to kind of think through this process. How does something go from here, nice and fat and thick and can be able to move, to something like this, where you got a lot of degeneration, you have these spurs, these osteophytes, the stenotic pattern here, the thinning of the disc. And at that substance, and that time, you're losing calcium from the bone. You're going into an osteoporotic and osteoporosis state. So having said that, let's get into what happens and why something as beautiful and thick and protective and mobile as this, if it's out of position, can cause inflammation. And that's the term I want you to lock in your head, is an inflammatory reaction. But we're going to get into one of the reasons why. And the reason why in this situation is how sugar, if you will, damages the system and causes you to begin to break down. Now, so we said that there's like 7 different reasons, 7 different causes of sugar: inflammation, joint pain, and so forth. So let's get into it a little bit. So the first thing that we want to remind you of again is there's this thing called inflammation, inflammatory reaction. Now, there's an interesting article that I have sitting in front of me, and I'm just going to quote from the study, and it says that young adults who drank a lot of sugary sodas and things like that, even apple juice and fruit drinks, you've heard me talk about the fructose in that. Here's the deal. They're 5 times more likely, if you will, to have joint pain than somebody who did not get into that situation. And they're 3 times more likely to develop an inflammatory arthritic pain. Arthritis, what are we talking about? Remember, I just showed you this. This is arthritis. This is a degenerative arthritis. This is spinal stenosis. So they're far more likely to develop this kind of nonsense with the swelling, the irritation, and so forth that is like that. So anytime you reach for that soda, every time you reach for that can of sugary added whatever it is, and you're drinking tons of fruit juices, you're increasing the possibility of problems. So we're going to talk about things like inflammation. We're going to go to that advanced glycation end products that we talked about a little bit last week. We're going to talk about insulin resistance a little bit. We're going to talk about your gut being altered relative to its normal microbiome, because that adds to it and so forth. So let's get into it just a little bit. Let's talk about, these different pieces of the puzzle. Inflammation, again, we're going back to our old friend. Inflammation is what causes pain, swelling, stiffness in the joint spaces, that tends towards that thing that we just called, right, arthritis, right, like this. So when you eat sugar, pro-inflammation, things that support inflammatory reactions, chemicals like things that are called cytokines, and they're released, into tissue, and the overall inflammatory reaction, the pain and the swelling that occurs exacerbates at a very high level. So how can we fix that? Obviously, you got to cut the crap out, meaning get the sugar out of your body. Now, we talked a little bit last time on advanced glycation end products, AGEs. Sugar molecules can bind, as we said, with proteins, and they can bind with fats. And so when you eat those sugary things, particularly fructose or anything that has added sugars to it, they produce many more AGEs to gather in the joint spaces and degenerate and damage it. Remember, I said if you want to have a good visual, and you can do it yourself. I mean, you don't even have to visualize it. Just go to do it. Get a saucepan and put a cup of sugar in it, and then turn the flame or the heat down very, 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 very low. And then stir it and stir it and stir it over time. What's going to happen? It turns caramelized, and it's sticky, and it's thick, and it causes breakdown and so forth. We found that these AGEs that people consume, high amounts of sugars in their body and so forth, end up with chronic diseases like rheumatoid arthritis, diabetes, kidney problems, damages, cardiovascular disease, Alzheimer's. Yep, you lose your mind on as well. So AGEs were even found to be in people at high levels who had osteoarthritis or joint space pain. And there's several studies that show that. Now, we're going to get back into, over time, how to reduce the AGEs. We talked a little bit about that. And one, get rid of anything that has an OS on the end of it as part of the majority part of your diet. Get rid of the added fructose corn syrups, period, end of story, get rid of them. Get rid of the vegetable oils, soybean and canola oils and things like that. Substitute them for things like real butter and olive oil and avocado oil. And you're going to find that your body is going to say, thank you very much. And things suddenly start loosening up. So if you live by the 85-15 rule, what does that mean? That means 85% of the time you choose real foods and things that your body can handle, things. And when you read the label, you can actually pronounce the words on them. That is going to go a long way to stemming the tide and stop the progressive onslaught. Because otherwise, if you're going to all these sugary things, whether it's a natural sugar or regular sugar, you got a problem. And that problem is going to continue to grow. Let's talk about something called insulin resistance. You've heard that term, and type 2 diabetes and so forth. But eating too much sugar straight up on a regular basis is characteristic of our diet here in this country. I just came back from overseas. I was teaching there, for several days, and the food is so different. It tastes so much better than the stuff that even is supposed to be good here in this country. Why is that? Because we don't process foods, number one, the same way. We add tons of sugars to everything in that we eat and we consume in our body. And more than 50% of all of us across the board have some degree of insulin resistance. Now, if you want to see how that's true, Walk around and count all the people that you think are overweight. Now, back in my day, we're going back several decades when I was a young guy. You look around, you go to the beaches, and there's a few people that were a little chubby, a little overweight and so forth, and they could use a little bit more exercise and maybe change a few things. But now that's the norm. You're seeing people that have these overly abundant midlines. Their derrieres, are padded, and I don't mean artificially. And you see softness all around us. One, we're not eating good whole foods, and that's what we're talking about today. And it's catch as catch can. So what happens is this: we're talking about insulin resistance. Eating a lot of sugar causes this insulin to be released often, constantly, right? So your body's saying, I got to go, I got to have insulin. Eventually your cells stop responding to insulin. They can't handle the constant triggering mechanism because they're starting to burn up all kinds of other nutrients that allow that transportation mechanism to take place. Your pancreas releases more and more insulin to try to keep the blood sugar stable. So it's like, I'm pumping that muscle, I'm pumping that muscle, I'm pumping that muscle. And pretty soon what happens, it gets fatigued, it gets tired, it can't do it anymore. And so your insulin levels then are suddenly going up for years, and then all of a sudden blood sugars, aren't responding the way they're supposed to. And your doctor says, well, one, if you're lucky, you're just getting into the pre-diabetic state, but pretty soon you're going to go directly into that diabetic pattern. At the point when blood sugars begin to creep above 100 on a regular basis, while you're fasting, you could be sure you have significant amounts of insulin circulating because your body's trying to help you. It's trying to stabilize you. And then you're noticing that this belly fat shows up. It's another sign that you have insulin resistance. That you go down and you grab those love handles, but now the love handles are extending to the front. That has a combination of a couple things. That's cortisol and insulin resistance. And that's a subject that we can talk about. If you join us coming up in the office at the Roselle Center for Healing in Fairfax on the 14th of this coming month, we're going to talk about all this. I'm going to show you how it affects your joints and why you're in pain, why your body won't heal, why you constantly have to put more and more medications to the test. Insulin tells your body to store more fat around the belly, right? And the organs and the muscles. And even if you look thin on the outside, it's hammering in the inside. That's called a skinny fat person. You like that, skinny fat person? Well, that's what takes place. So it's extremely harmful when this constant situation releases inflammatory reactions. There's a chemical that's called TNF alpha and interleukin 6. You remember interleukin 6 back in the days of COVID? Everybody heard about that? It's a crazy cascade of inflammatory reactions. That's a windup that keeps going and going and going. And it tells your liver to release more, something called CRP. It's a common marker of inflammation. And make sure your doctor is testing for that CRP level. And also another one called or small molecule or coronary heart CRP, because it tells you whether or not your heart's in trouble as well. It puts your body in an excitable, pro-attractable inflammatory state that leads to more insulin resistance, more weight gain, more pain, more stiffness, and unfortunately the diabetes and the heart disease. But that's where that pain comes from. It doesn't let go. Now what happens is that this beautiful vertebrae here now gets inundated. Remember that AGE, that glycation pattern? That can happen to any joint in any tissue. And it begins to cause degenerative processes over a period of time. So when you go through the process of trying to understand, what can I do for myself? Why isn't the drug my doctor's giving me helping me? I'm going out and I'm taking these injections to burn my fat. And by the way, there's going to be a problem with that too. And we'll talk about that on one of the programs. Look, you got control. You are the one in the driver's seat. You're the one that's taking and putting things in your mouth. You're the one that's sitting on your derriere and not moving, not going anywhere. Okay, so we can reverse this thing. We've got to drop the sugars down to less than 25 grams per day for women and about 35, 36 grams a day for men. And when that's the case, and we're really good at it, we're willing to do it, we're willing to bite the bullet, if you will, then things get better. But when we treat a patient and we see a patient coming in and they have advanced disease, meaning arthritic conditions, leading to things like gout, leading things like rheumatoid arthritis, we have to look at the whole body at that point. We've got to look at the gut microbiome, the good bacteria. We've got to be able to restore it. We have to look at deficiencies of zinc. Every patient that comes in our office, we test for zinc. We test for acid-base balance in the body and so forth. It has to be done because otherwise you're not going to get any resolution on these things. Temporarily removing foods from your body and desensitizing them. And we do it through neuromuscular function response testing, and it works really, really well if you're willing to bite the bullet. But in most situations, when we start treatment, we put motion back in the spine. We use low energy light lasers to trigger the reaction, to drop the inflammatory reactions. We detox the body. All of a sudden, you're going to see people turn around, and minimally, you're going to get a 70% improvement in symptoms within the first 3 weeks. If you do everything that needs to be done. See, we need you as a partner, and you need you as a partner. You need to hold yourself responsible for, the things that are going on. So let's move forward a little bit because there's so much to do. And I want you to join us, on that Wednesday evening on the, I think we're dealing with, Wednesday, I am kind of backing up. Wednesday the 14th at 6 p.m. at the Roselle Center for Healing in Fairfax, Virginia. Join us, okay? Give us a call. Register online. You can see the flag in front of you. Get it done. But it's 703-698-7117 and join us. We're going to have some fun. I'm going to show you why you're in pain. I'm going to show you why you can't move. I'm going to show you why it's causing heart problems. We're going to get into it. But more importantly, today we're talking about the 7 signs that you can, and hopefully we're going to get through them all. But when we're dealing with certain things, how about gout? You know what that gout is? Gout is the formation of these shards called uric acid. They're like little sharp glass pieces. They get in the joints and they tear the joints up. It comes from liver and gallbladder function problems. Liver primarily. It's called purine metabolism failure. The incidence of gout in this country has doubled in direct relationship to the sodas that we see being consumed in this country. Doubled. There was a study that I think I read, a couple of weeks back, and it says that men who drank 2 sodas a day had an 85% higher risk of gout than those who drank it on a rare occasion, once in a while. So if you drink the sodas twice a day, you're maybe going to get some alcohol on top of that. You like shrimp and shellfish and so forth. You have set the stage for a major gout attack. And the first place it's going to hit is your big toe. It'll get into your knees. Your knees will get stiff, but also it's going to get into your spine. It's going to cause your spine to break down, and it causes spine now to lack of motion. You're going to spend a lot of time with me because we've got to get that squared away and get you back to normal. And you know me, those of you who are my patients, I'm on you constantly. Don't do the things that are going to destroy your life. So we've got to reduce our sugar intake if we want to have flexible joints. We have to understand that, nobody's a saint. It may not be 100%, but we have to begin to take responsibility. Get out and go for a walk, even though if it hurts a little bit. As you drop this stuff, it'll feel better. So we're going to show you how to do that when you come, and we're going to show you how it's affecting your body across the board. But I'm telling you, if you don't begin the process of restoration, you're in trouble. We talked a little bit about the intestinal tract and microbiome. Everybody's heard the story about the leaky gut and food sensitivities. Well, this is more important than any place else because the leaky gut means that you got these little holes in the intestinal tract that are not acting as the guardians as they're supposed to be. And they allow foods to come in that haven't been fully digested. They're allowing harmful bacterium, harmful parasites to come into the system where they should be broken down. So that this sugar that we're talking about causes leaky gut and increased intestinal absorption. We call it permeability. And basically these tiny holes that are getting bigger and not protected, or more of them, I should say, is causing this pro-inflammatory reaction. And it gets through it, it enters into your circulation, then it goes into the joint spaces. Now you got proteins that shouldn't be there, you got bacteria that shouldn't be there, you should viruses that shouldn't be there. And now you got a problem. And parasites, by the way. And when you look at somebody who has a parasitic reaction and they're hurting all over the place and it's predisposing them to other things, often it goes right back to what we're talking about, this leaky gut situation. In every case that I've ever seen over the years, somebody who has fibromyalgia, somebody who has an inflammatory arthritis, somebody who has an autoimmune condition, in every case, bar none, in over 48 years of practice, I haven't seen one, not one, that hasn't had this situation, at least in part, as part of the presentation. And unless we deal with that, unless we heal that, it's not going to go away. And you have to take responsibility yourself. You've got to look at, what am I eating? Am I grabbing things as I possibly can? Am I just, shoving things into my mouth that, shouldn't be there? Well, my guess is probably yes, that you're not reading the side panels. Look, if you pick up the side panel of anything, right, any kind of product, and it looks like a chemistry set, you start reading through and you don't understand the terminology, that's a good tip not to use it, because it's going to have all kinds of other alterations within your system. You may be dumbing down the irritation for a second, that craving for food, but all of a sudden you're bloated. All of a sudden you don't feel good. All of a sudden you got a headache. All of a sudden you want to go to sleep. All of a sudden you're stiff and you don't know why you're in pain. And the symptoms are essentially all over your body. That is a leaky gut food sensitivity pattern. And we're going to show you how to deal with that when you join us on the 14th in next month coming up. So we're going to teach you, things about how to heal that leaky gut. We're going to talk about things that are what we call mediator release patterns in the body. Dr. Scott Lamp, who all of you know, he's a brilliant guy. He's my ADD child. This guy's got more information revolving in his head than any three people I've ever met. The two of us are going to tag team. He's taken the old program of, sugar, public enemy number one, and basically saying sugar is still public enemy number one, but we're going to talk about it in a lot of different ways. But more importantly, this joint pain, this destructive pattern that you're getting because you're not paying attention. You're not paying attention. So remember, the sugars, particularly fructose, is damaging the system. All the chemistries that are in there are causing that intestinal permeability. So if you did nothing else, right, switch to eating natural sugars, things like a little bit of honey. I didn't say anything else. I said a little bit of honey, a little bit, and watch all the carbohydrates, look at the packages, make sure the fructose isn't there, and get a little motion in your body, and don't sit there and read the side panels of everything that you do. If you see fructose, remember I said last week, the story of O's, O-S-E, that's sugar. Period. End of story. So if you see a lot of that stuff, and guess why it's all there? Because it's addictive, and all the manufacturers know that. It's addictive as hell. So join us. I'm going to give you ways of getting out of that joint pain, how things need to be. But once you get to the place where this joint has been altered and it's starting to move towards this thing, you see the difference? See what happens over time? This goes to this. Well, when you're starting that process going down the tube, now you've got to get motion back in the joint. You got to restore normal chemical balance. You've got to bring up the energetics in the system. And you've got to do it consistently long enough to make sure that there's a difference. I promise you can be. You can take this and you can go back to this. Minimally, you can go back to increasing the disk space, but there's a progress and a progression. It goes from something healthy to something not so healthy to something that's degenerative. You pick, but let's turn that thing around. Let's get things resolved for you. Remember, I'm here every Sunday for one reason only. You deserve the information. And I guess I've been telling you the wrong day. It's the 21st of the month. Oh my. So put May 21st down. I didn't think it was that far out, but apparently it is. So you're going to have to listen to me roll a little bit longer on all this stuff. So May the 21st, that means I have another week to prep for you and give you the right information. But join me. I promise you that I will show you things that you didn't think about. We're going to have sugars there. So I'm going to test muscles. I'm going to show you what happens when you get close to any of these things. I'm going to show you pain thresholds that will kick back up very rapidly. So if you want to see what the destructive power is, we already know it leads to cancer. We already know it leads to dementia. We already know it leads to tumor formation. So now we're talking about pain. We're talking about the number one thing that stops all of us from living a life that we should normally live well. So join me the 21st of May, 6 p.m. at the Roselle Center for Healing in Fairfax. Make the reservation right now. I'll see you then, and I'll see you next week. And remember, I'm here every week for one reason only. You deserve the information, but more importantly, I love you all. Have a great Sunday.